As the years go by, you may notice some subtle changes in your health. This video will cover the 7 silent symptoms after 60. The doctors say you must never ignore, focusing on signs that often go unnoticed but deserve your immediate attention to ensure your continued well-being. This is not about causing alarm, but about informing accurately and offering clarity on what to watch for. The importance of these silent symptoms is undeniable, because early detection can make a huge difference in treatment and quality of life. Ignoring them can lead to serious complications that could have been prevented or effectively managed with the right intervention. Understanding these signs is a proactive and empowering step toward taking care of your health and maintaining your independence with confidence. In this script, you'll discover exactly what those 7 specific symptoms are, why they are considered silent, and why health professionals stress their importance so strongly, and what the evidence says. Our goal is to provide a clear, evidence-based guide, never to replace a specialized medical consultation, but to complement your knowledge.
My information is compiled from recognized medical guidelines and studies in geriatrics and public health. I'm not a doctor. I act only as a compiler of information validated by experts to bring you reliable and accessible content while always respecting the complexity of human health. The intention is to empower you with knowledge so you can have more informed conversations with your own physician.
Conversations with your own physician. To help you identify these signs clearly, it's essential first to understand the overall picture of health after age 60. What we often consider normal aging can sometimes mask conditions that require attention and intervention. Let's start by exploring that broader picture before diving into the symptoms themselves with the depth the topic deserves. The human body naturally undergoes many changes as we age. Decreases in bone density, metabolic changes, and reduced immune function are expected and part of the process. However, it's crucial to distinguish these normal physiological processes from the emergence of diseases that require intervention. The line between normal and concerning can be very thin, demanding constant vigilance. It's also important to understand that some symptoms in older adults present atypically, differently than they would in younger people. For example, a urinary tract infection may not cause fever or burning during urination, but instead sudden confusion. This atypical presentation is a key concept in geriatrics and makes identifying the 7 silent symptoms after 60 both more challenging and more critical for your health. While some people think actively looking for problems sounds alarmist, many geriatricians consider it essential preventive medicine. They argue that proactivity prevents worsening conditions and improves outcomes. Others prefer to focus on quality of life and not worry excessively, but the right balance between these views is vital for healthy, conscious aging. Think of maintaining a vintage car. You don't expect it to perform like a brand new model, but you know that certain noises or warning lights mean it's time to see a mechanic. In the same way, our bodies after 60 require closer attention to warning lights that we might previously have ignored, but that can now indicate significant problems. With this understanding that health in later life requires special attention to subtle signs, we're ready to dive into the specifics. Get ready to learn the 7 silent symptoms after 60 that doctors say you must never ignore, and how to recognize them in yourself or your loved ones. That will be the focus of our next detailed exploration, one by one. The first of the 7 silent symptoms after 60 we'll discuss is unexplained weight loss. Losing 5% or more of your body weight in 6 to 12 months without intentional changes in diet or exercise is a red flag that deserves investigation. For example, imagine you weigh 70 kilo and lose 3.5 kilo or more in 6 months, with no significant change in eating habits or physical activity. Even if it seems minor at first glance, this is an important alert. Weigh yourself regularly, perhaps weekly, and keep a record of any changes so you have concrete data to share with your doctor. It's essential to distinguish this from intentional weight loss, e.g., following a specific diet for diabetes or starting a new exercise routine. If the weight loss is accompanied by fatigue, weakness, loss of appetite, or changes in bowel habits, the urgency to see a doctor increases significantly. Of course, small day-to-day weight fluctuations due to hydration or meals are normal. The concern arises when the loss is unexplained, no apparent cause, and sustained over time. If you know the reason for your weight loss, the alert level may be lower. When in doubt, however, a medical consultation is always the safest strategy to rule out serious issues. Understanding unexplained weight loss is the first step toward proactive health. But there are other signs just as important that deserve your careful observation. Now let's look at another silent symptom that is often mistakenly accepted as a normal part of aging, yet can point to serious underlying health problems. The second silent symptom is persistent and unexplained fatigue. We're not talking about ordinary tiredness after a busy day or a poor night's sleep, but an overwhelming exhaustion that does not improve with rest and lasts for weeks or months. This type of fatigue is one of the most underestimated of the 7 silent symptoms after 60. Imagine that simple tasks, showering, getting dressed, preparing a meal, become so exhausting that you need to sit or lie down despite little physical effort. Track how long the fatigue lasts, its intensity, and how it affects your daily activities and energy levels. That information is invaluable for your doctor. Fatigue can manifest as constant lack of energy, generalized muscle weakness, difficulty concentrating, or a heavy feeling throughout the body. Pay attention to accompanying symptoms such as paleness, frequent dizziness, or chest pain. These details help paint a clearer clinical picture. It's natural to feel more tired after a bad night's sleep, intense emotional stress, or unusual exertion. But when fatigue becomes chronic, disproportionate to your activity level, and has no obvious cause, it fits the profile of a concerning silent symptom. Don't confuse it with the normal need for a slightly slower pace in older age. The third symptom of the 7 silent symptoms after 60 is balance problems, or frequent falls. While an occasional tripping is understandable, recurrent falls or a constant feeling of unsteadiness are not a normal part of aging and should never be ignored. Have you ever felt a persistent pain that seems to settle in and become an unwanted part of your daily routine? Perhaps lower back pain that won't go away, a joint that creaks more than usual, or headaches that have become frequent. It's easy to chalk it up to getting older, but that's a dangerous trap. Pain, especially when long-lasting, is one of the 7 silent symptoms after 60 that doctors say you must never ignore. An important signal that something more serious may be happening in your body. Many people say pain is just part of old age, but that's an oversimplified and potentially harmful belief. While the body changes with time, pain is not an inevitable feature of healthy aging. It is a sophisticated alarm system. Don't self-diagnose or downplay what you feel. You have every right to seek comfort and answers. How you perceive pain or any bodily change is crucial. But what if the way you perceive the world around you is quietly shifting, almost imperceptibly? Your senses, once reliable guides, may be sending silent signals that many doctors insist must not be ignored, and they are often the first to be neglected. Your eyes and ears are your windows to the world, and any alteration in them can profoundly affect safety and social interaction. Have you found yourself turning up the TV volume more than before, or noticing that book letters look a little blurrier even with your glasses? These are not mere inconveniences or signs of tiredness. Subtle changes in vision or hearing beyond what is typical for age can signal treatable conditions or more complex problems. Gradual vision loss increases fall risk and threatens mobility and independence, while hearing loss can lead to social isolation and has been linked in some studies to higher risk of cognitive decline. You might struggle to follow conversations in noisy places, constantly asking people to repeat themselves, an exhausting and frustrating experience. With vision, sudden flashes of light, halos around lights, or a dark spot in the center of your visual field are red flags requiring immediate attention. Many of these silent symptoms progress so slowly that you adapt without realizing how serious the situation has become. You are the best observer of your own body. Don't wait for family or friends to notice you're straining to see or hear. Schedule routine checkups with ophthalmologists and ENT specialists. Early detection can preserve your quality of life and independence. Ignoring these signs means missing the window for easier, more effective intervention. Perception of the world is fundamental, and balance is a direct extension of that, essential for every step you take. The way you move and the confidence with which you get around are vital for independence and enjoying each day. You've now uncovered several of the 7 silent symptoms after 60 that doctors say you must never ignore. So what should you do with this knowledge? The first step is active vigilance. Keep a simple journal of any changes, no matter how small, you notice in your body or mind. Bring those observations to every medical appointment clearly and objectively. Be proactive. You are your own best health advocate, and your voice matters. In addition to ongoing communication with your doctor, adopt habits that promote longevity and well-being. A balanced, nutrient-rich diet, regular physical activity suited to your abilities, and restorative sleep are your strongest allies. Keep your mind active with reading, games, puzzles, and social interaction. There are many trustworthy online resources from reputable health organizations for further reliable information. It's important to be realistic about aging. It brings natural physiological changes, and not every change is a serious disease. The goal is to distinguish normal from concerning and investigate when needed. Don't expect a miracle cure for age, but rather effective management that can dramatically improve your quality of life. The aim is to live longer and better, with dignity and autonomy, and that starts with knowledge and conscious action. You've just received crucial information for your health and well-being. Now you can be an active participant in your own journey. If this video added value and helped demystify these silent symptoms, please consider sharing it with someone else who might benefit. And if you appreciate ethical, transparent health content, subscribe to the channel so you don't miss future videos. And leave a comment telling me which symptom you found most eye-opening. Remember, your health is your most precious, irreplaceable asset. Don't put it at risk by ignoring the quiet signals your body sends. You have the power to seek help, ask questions, and demand the answers you deserve from qualified professionals. Stay alert, stay informed, and be proactive at every stage of life. Your independence and quality of life in your golden years depend on these conscious choices and self-care. Take good care of yourself. You deserve to live every day to the fullest.